4 out of 5 women develop nausea and vomiting during their pregnancy. Although this is called morning sickness, nausea can occur at any time of day or night. For most women, it's typically worse during the first 12 weeks of pregnancy, but for many women, it continues throughout their entire pregnancy. This video discusses an amazing step towards helping hundreds of millions of women and the fascinating scientist who knows the full cost of this condition. And finally, putting this together with other recent findings, it appears that a component of goat's rue is increasingly being recognized as a wonder drug on par with aspirin. After 20+ years of trying to determine the cause, there has been a major breakthrough. Dr. Fezjo, a geneticist at the School of Medicine of USC in California, conducted a genetic study with women who had previously been pregnant. This was done through individual DNA submissions to 23andMe, a genetic sequencing company which can determine health and ancestry insights. Dr. Fezjo found a connection between those women who suffered from severe nausea and vomiting and pregnancy, requiring intravenous fluids and a variant in gene coding for a protein named growth differentiation factor, factor 5, or GDF15, a hormone that acts on the brainstem. This association identified further research needed to understand the role of GDF15 and pregnancy. GDF15 is secreted from the placenta in the first trimester of pregnancy. It seems to be playing some role in the mother from immunologically rejecting the baby. Therefore, this tolerance function is likely vital in enabling the pregnancy to continue. GDF15 is also shown to be a regulator of physiological body weight and appetite via the brain. It is overproduced in people with cancer suffering from severe appetite and weight loss. The hormone's effects seem to be dependent on the mother's sensitivity and pre-pregnancy exposure to GDF15. Those women who had high exposure to GDF15 prior to becoming pregnant had no nausea or vomiting symptoms despite having high levels of GDF15. It's hypothesized that prolonged exposure to GDF15 before pregnancy could have a protective effect, making women less sensitive to sharp surges in the hormone caused by the developing baby. The exposure relationship is quite uncommon and provides additional information. It also suggests a potential treatment. Women could be desensitized to prevent severe nausea and vomiting by increasing exposure of the hormone before they become pregnant. Much like how some people are treated for dietary allergies through controlled exposure therapy, Metformin is already used for gestational diabetes. GDF recently identified to be increased in stress and in response to Metformin. It can be increased with exercise, plays a role in suppressing appetite and inflammation. So GDF is being looked for metabolic syndrome, fatty liver disease, and similar disease. GDF15 is also very interesting in that it may play a role in transplant rejection, in some ways similarly to the role in fetal rejection. Heart disease may be modulated by GDF15. In November 2021, the Harvard Health Letter asked, is Metformin a wonder drug? In other words, one that is very cheap with multiple very significant health benefits. Metformin is already used for prediabetes, gestational diabetes, polycystic ovary syndrome, PCOS, and weight gain from antipsychotic medicines. It is being investigated for lowering the risk of cancer in people with type 2 diabetes, lowering the risks for dementia and stroke, and lowering age-related diseases and increasing overall lifespan. Metformin is also being studied for possible increased milk production in lactating mothers. Interestingly, Metformin is derived from goat's rue, an herb given to goats in the past for increased milk production. After centuries of use dating back to ancient Egypt, it was found to contain a rich supply of guanidine, which in the 1920s was revealed to reduce blood glucose and reduce excessive urination in diabetes due to same. But it wasn't approved for diabetes for many decades later. Like the heroine of our story today, Metformin was for a long time underestimated and forgotten. Dr. Fezjo was a victim of hyperemesis gravidarum and sadly even lost a pregnancy a couple decades ago. She faced the misogynistic belief that HG and nausea and vomiting in pregnancy was primarily psychological. Now, thanks to her maternal devotion and sustained work to identify the biological basis and thus right wrongs in prenatal care, patients across disciplines are poised to benefit greatly.